Hello, so today I'll be talking about kidney cancer. So what is kidney cancer? It's a cancer that begins in the kidneys and the cells in the body begin to grow out of control, forming a lump called a tumor. Most common kidney cancer is renal cell carcinoma. And in today's PowerPoint, we'll be talking about the etiology, demographics, the anatomy, physiology and symptoms, diagrams, and treatment plans. So what causes this disease? From genetics, people with a strong history of kidney cancer can have a higher chance of getting it. Others may inherit genes that increase their chances of getting kidney cancer. Some rare inherited conditions would be the von Hippel-Lindau syndrome, found on chromosome 3, and when mutated can lead to uncontrolled cellular growth. Tuberous sclerosis complex syndrome is a multi-system hereditary disorder labeled by the growth of benign tumors in multiple organs, including the kidney. Moving on to the environmental, exposure to cadmium, like metallic elements, working with batteries, paints, or welding. Behavioral risk factors will be smoking tobacco, nutrition, weight, long-term dialysis, and high blood pressure. Here we have who is most likely to develop kidney cancer. It's the people from ages 65 to 74. Kidney cancer isn't common in people younger than age 45. Men are twice more likely to get kidney cancer than women, more common in African Americans and American Indians / Alaska Natives. Moving on to incidence and prevalence, there are more than 430,000 new cases of kidney cancer worldwide. Here we have a comparison of the United States versus 3 other countries. So in the United States, the incidence rates would be 69,569 new cases. The 5-year prevalence rate from all ages would be 64.56 per 100,000 population. In Lithuania, the incidence rates there would be 814 new cases. The 5-year prevalence there will be 86.51 per 100,000 population. In Czechia, the incidence rates, it is 3,314 new cases. Their 5-year prevalence rates of all ages would be 91.75 per 100,000 population. So lastly, we have Uruguay, and their incidence rates would be 774 new cases, and their 5-year prevalence rate of all ages is 59.82 per 100,000 population. And here, Czechia had the highest rate from the 5-year prevalence at 91.75. Now we move to the anatomy. So here we have the urinary system, which consists of 2 kidneys, 2 ureters, a urinary bladder, and a urethra. The kidneys alone perform functions like filtering the renal blood flow and removing waste from the body that is not needed through urination. So for the uterus, it plays an active role in urine transportation. As for the urinary bladder, it stores the urine, and the urethra, it carries the urine from the bladder to the outside of the body. Moving on to the organs. So here we have a healthy kidney and a kidney with a tumor. So kidneys is a homeostatic organ that maintains our internal fluids. It is small, dark red organs with a kidney bean shape and are the size of our fist. Now we move on to tissues. So here we have kidney cancer, and it often starts at the lining of very small tubes in the kidney called tubules, surrounded by a layer of fat and connective tissue. So here in the red, you can see that the tumor is made up of large round cells that connect together to form large groups of cells. So now we have the physiology of it. So kidneys filters fluid from renal blood flow, which lets toxins, metabolic waste products, and more than needed ions to be excreted through urination, all while keeping the necessary substance in the blood. When kidneys aren't functioning due to kidney cancer, in this case, the body will retain waste products leading to symptoms like blood and urine, low back pain on one side, swollen ankles, legs, a mass on the side or lower back, and incidence of findings. Blood and urine can be caused by bladder or urinary tract infection. Lower back pain can be caused by a large tumor itself that can cause urine drainage to be blocked. Swollen ankles, legs cause when kidney tumors prevents the kidney from removing excess fluid in the body. A mass on the side is caused by the enlargement of a tumor. So now we have the long-term consequences if not treated. So if left untreated, kidney cancer can spread to other vital areas in the body like bones, lungs, or brain. And if symptoms worsen, ultimately it leads to death. So now for the survival rates. So localized, meaning cancer has not spread to surrounding areas, you have the 93% chance. Regional, cancer spread outside of the kidney, you have a 71% chance. Distant cancer has spread to other parts of the body like lungs, brains, or bones, you have a 14% chance. And if all these stages are combined, you will have a 76% chance. We'll move on to diagnosis and treatments. So most of the time, kidney cancer is diagnosed incidentally when going to get lab tests or imaging tests for other reasons. The next step is to determine the stage of cancer by imaging tests, blood and urine tests, biopsy. Treatments to fight this disease would be non-surgical, like freezing your cancer cells or heat your cancer cells. Surgery is removing the affected kidney, which you remove the whole kidney and some healthy tissue along with that. And then the removal of a tumor from the kidney, so you will partially remove your kidney and the surrounding healthy tissues. Recurring cancer treatment / progressed kidney cancer. So targeted therapy, immunotherapy, and radiation therapy. So you do not see chemotherapy on this list because usually the last resort because it just doesn't work well with kidney cancer. But after doing targeted therapy or immunotherapy and that doesn't work, then we'll want to chemotherapy. Some side effects or risks of the treatment. So surgery, we have from infection, excess bleeding, pain, to more serious side effects like kidney failure, damage to other internal organs. Radiation therapy, we have skin problems, fatigue, diarrhea, and vomiting. Immunotherapy, we have skin problems, fatigue, and diarrhea. So can a person be cured or is it reoccurring? So a person with kidney cancer can be cured if detected early, stages 1, 2, and 3. It could be surgically removed. It can also be reoccurring, meaning the cancer can come back, but if time passes with no sign of kidney cancer, the less chances of it reoccurring, but of course, there will always be a small chance of it coming back. AI model. So we do have an AI model for to diagnose kidney cancer, which is the algorithm combining deep learning with existing contrast CT scanning to help radiologists pinpoint more confident diagnosis, thus cutting the spread of cancer faster. Deep learning algorithm has a 70% accuracy rate in diagnosing the most challenging scans. And as for treatment plans, there's no AI and treatment plan combination right now. But researchers do hope to one day integrate information about a patient's medical history to individuals' prognosis and treatment. And that'll be it for my presentation today. And here are some of my references. And thank you for watching.